This or additional thoughts that you'd like to bring to our attention? If so, please have at it.
Well, thank you, Mr. Garamendi. Actually, I do, and I'd like to point out that the Democratic motion to instruct conferees, as you pointed out, you serve on that conference committee, passed on November 14th with bipartisan support. And that motion encouraged the conferees to reauthorize an effective dam security program. Now, the goal here is to reduce risks to people, to life and property from dam failure. With the age of some of these dams and the aging infrastructure in place, the potential loss of life and limb and property is astronomical. And by putting money into maintenance now, we are saving not only lives and property, but saving money downstream because we know that sooner or later, with the age of that infrastructure, that it's going to fail. So that's one of the important things that the Democratic motion to instruct conferees did. Now, additionally, Mr. Garamendi, I signed the bipartisan letter to the leadership, to the House leadership of both parties, requesting a speedy conference report. We need to move this conference report. As you pointed out earlier, Mr. Garamendi, this has been waiting for 6 years now. We can't afford to wait another 6 years. So we need a speedy conference report between the Senate and between the House so that we can merge that legislation, add the items that we believe are on the House bill that need to be part of that Senate bill and vice versa, so that we can begin bringing these jobs back to America and bringing the use of these American products to our districts. That letter emphasized the importance of WRDA, not only to the district, but also the difficulties which it imposes on business and on labor and on the trades if this bill is not moved in a prompt manner. One of the other important aspects of the bill for my particular district, you were talking about the Sacramento River, but one of the particular parts of the bill that we want to see added that has passed the Senate establishes the Metro East Flood Risk Management Program. And what we're talking about there is the urban and industrial area in southwestern Illinois across from St. Louis, running all the way from Alton down through East St. Louis south to Columbia, Illinois. It encompasses 3 counties with a population of about 600,000 folks. So it's very significant. It includes oil refineries, steel mills, chemical plants, residential areas, and many of the bridges, both rail and passenger car that transit the Mississippi there. So it's critical that we get this taken care of.
Well, we also, Mr. Andrew, in California, we have those same issues. We have the let me swap places with you. I want to put up one of the maps here of California. Mr. Andrew, you were talking about the central part of America. And you certainly can see it here as you were discussing the Mississippi River system and your area up here in the Illinois area. But in California, we think we're a real big state, and we got a lot of people, and this legislation is extremely important for California. I'm going to just point out some of the San Francisco Bay, one of the great maritime bays in the world. We would argue there's none more beautiful nor more important than the San Francisco Bay. In and out of this bay flow a vast amount of commerce to the port of Oakland and also up into the rivers, into the central part of California, through the Delta on the Sacramento and the San Joaquin River, where trade now goes, international trade, to the port of Sacramento and the port of Stockton. Very, very important because, like Illinois and the great Midwest, we have a vast agricultural economy here in the Central Valley of California, and a lot of that, particularly rice from my district, goes out of the port of Stockton and Sacramento. Both of those ports now have channels that are of insufficient depth to bring in the large ships, and so it becomes much more expensive. The issue you raised, Mr. Enyard, about the cost of shipping. If you have small ships that can't carry a full cargo because of the depth of the channel, it gets more expensive. So in this area, channel maintenance at Port of Oakland, channel maintenance for the ports of Sacramento and the like, and of course up along the Contra Costa County area where the refineries and the oil tankers come and go. As you move further south, we've got the ports mostly fishing down here along the coast, and of course Monterey, which is famous Pebble Beach and the Monterey Bay area. And then you get down to Los Angeles, and the two great harbors of America, side by side, together form the largest harbor system in this nation, and you can argue whether it's the largest in the world, but it is surely big. The Port of Los Angeles, represented by Congresswoman Hahn, and the Port of Long Beach, side by side there in the Los Angeles area, Long Beach represented by Mr. Lowenthal. Those ports are really one of the major engines of international trade and economic growth. And of course, from those ports, those great cargoes move in and out all across America on the railways and highways. And so we have that, and then of course you can get down here to San Diego, some other harbors along the way in Orange County, and then the great harbor of San Diego, which is extremely important for the military. Anytime you happen to get to San Diego, you'll see the aircraft carriers there from the U.S. Navy and other critical equipment and ships of the U.S. Navy. But all of that's important. But here in my district, I'm going to put up another map. And this is where I really get involved. This is a map of, obviously, San Francisco Bay here, with the harbor of San Francisco, the port of San Francisco, the port of Oakland, Alameda in here, and up along the Contra Costa coast. But as you get into the delta, this is the largest inland delta, or the largest delta on the west coast of the Western Hemisphere, and one of the great inland deltas of the world. There's more than 1,000 miles of waterways here in this delta area. I represent about half of that area, the Sacramento River going up here and the San Joaquin River coming here and then down into the great San Joaquin Valley. These areas are all protected by levees. And so the rivers are confined within those levees, and many of those levees, as I said a while ago, are more than 100 years old. And they need protection. The water system of California, water flowing from the north across these through these waterways that are channeled by the levees to the great pumps down here, delivering water to the Southern California and the San Joaquin Valley, depend upon these levees. This is part of the WRDA bill. And so these levees and the protecting the water system of California and the great agricultural enterprises of the Delta are critically important, and the Water Resource Reform and Development Act provide money for the maintenance and the continuing studies of these levees, as well as for many of the critical environmental habitats in the area. As you move up the Sacramento River, you'll come to the great metropolis of Sacramento, which I talked about, and here the American River coming in with the Sacramento River. And right in this area is arguably the highest flood danger area in America. And there's a project right here in the Natomas area that's absolutely crucial to life and limb. And then as you move on up in the rest of my district, going up 200 miles from here to here, you have Yuba City and Marysville, again communities that have flooded in the past with the loss of life, and those two are dependent upon the success of the WRDA bill. Now, what we're going to do tomorrow and in the days ahead as we move through this conference committee, and my task, to get the policy set. But the other side of it is the money. Where's the money coming from? Well, the austerity budgets that have been such the prize of our Republican colleagues really have stripped money away from the projects that we have been talking about. stripped money away from the maintenance of the ports, the dredging of the channels, and the protection and enhancement of the levees. And that money has been stripped away, and so with the first sequestration that took place about 8 months ago, $250 million of money that the Corps of Engineers would have for the ports, for the channels, and for the levees disappeared. That was sequestration 1. On January 15th, sequestration 2 hits with another $90 billion hit, and we're not sure exactly how much the Corps of Engineers will lose, but they're going to lose a vast amount of money. And so all of the talk, all of the energy that we're putting into writing the appropriate policies to reform, to improve, to put programs in place for the American economy aren't going to happen. Well, many of them are not going to happen because of the austerity budgets and the 2 sequestrations. This is a critical problem, And I would reach out to my colleagues, both Democrat and Republican, and say, but there is money. There is money available, but we're not spending it in the right place. In the in the budget bill that passed the House of Representatives a few months ago, there was an increase in the authorization well above what the President wanted to build and rebuild nuclear bombs. Over $12 billion over the next decade for just one life extension program on a nuclear weapon, the B-61, $12 billion. Now, it can be argued, and I would argue this, that that was an extraordinary, inappropriate place to spend money. We don't need that bomb for deterrence. I don't believe. Well, the military may argue that we do, but then they can never get enough of these things. But my argument is we need to spend the money where real danger exists. And that real danger exists on America's rivers. When these levees are not up to standard, when the levees protecting New Orleans are not up to standard, people died, billions upon billions were lost. When the levees in Sacramento are not up to standard, billions will be lost and people will die. And that's an immediate threat. We got plenty of other nuclear weapons for deterrence. But to spend $12 billion in a way that I believe would be better spent on things that protect real people in real-life situations. So we're making judgments here. First of all, we're making a judgment. Well, I wouldn't say either you or I, Mr. Enu, are making this judgment, but our colleagues, potentially on the Republican side, are making a judgment that they believe you can build the American economy with austerity. That is, to cut the federal expenditures. I disagree. There are critical investments that the federal government should and must make. This is not new. Often we hear the talk around here, the Founding Fathers. Mr. Enu, have you ever heard people talk, well, the Founding Fathers would do thus and so? We hear it all the time. The Founding Fathers, let's take Washington and Hamilton, shortly after he was inaugurated, oh, by the way, Washington refused to be inaugurated in a suit made in England. He was inaugurated in a suit made in America. There was only one tailor at the time that would do that, but he did it. And then he told Hamilton, I want a policy to build the American manufacturing sector. Hamilton came back some days later, probably 2 or 3 months, with a program. Not 2,000 pages, but probably a couple hundred pages at the most. And he said, we need in America to do the following things: to build the American economy and the American manufacturing base. He said, 1, we need to build ports. We need to build canals. And we need to protect American industry by using American taxpayer dollars to buy American-made goods. And he said, beware of trade policies. Hamilton and Washington wanted trade policies that protected the American manufacturing sector and American agriculture. Interestingly, in the next few days, or the next few weeks, we're going to have the question of trade policy before us here in the House of Representatives, and it's likely to be the Trans-Pacific Trade Program. What is it? Well, they want to fast-track it where not one person on this floor will be able to say, wait a minute, we ought to change this or we ought to change that. So we ought to be paying attention to the founding fathers who said, watch trade policy, protect American jobs. So as we go through all of this, in my district, we're going to have the money. American taxpayer money, plus a lot of local taxpayer money to protect the citizens in my district and the ports. About $1.8 billion is collected at the ports to rebuild, to dredge, and to maintain the ports. About half that money is siphoned off for other projects. Beware of austerity budgets. No more sequestration. This nation cannot afford that terrible policy of sequestration because it will rip the heart out of the critical investments that America has to make. I rambled on here for a little while and went off to some other things. Mr. Enyard, would you like to pick it up for a while?
Thank you, Mr. Garamendi, and I appreciate that. You know, what we're really talking about here, Mr. Garamendi, it seems to me, is are we spending money or are we investing in America? You know, I like to tell folks at home that, you know, when that roof starts getting old on your house, and you know those shingles need to be replaced, do you want to replace those shingles? Do you want to put a new roof on that house before it starts to leak? Yes, you want to do that because you're going to save the money then of the damage that's going to be caused when that roof does start to leak. And we're really talking about the same thing here. We're talking about investing in America. We're talking about investing in our house, investing in our home, protecting that infrastructure, protecting that roof before it does begin to leak. And you know, it's interesting you were talking about how money gets siphoned off, and this bill does change that. This bill would increase, you know, we have a special fund that's supposed to go to the maintenance of harbors and of ports. And this bill would increase the investments in improving our nation's ports by increasing the percentage of the money that's collected each year through the Harbor Maintenance Trust Fund. As you pointed out, it's unfortunate, but half of the money that is collected to maintain harbors gets siphoned off and spent on other things. Now, I believe, and you believe, we believe, and the folks who voted for this bill believe that we should spend that money for the purpose for which it's collected, and that's to maintain and improve our harbors and our ports. Now, you know, some of the Democrats on the committee have said that the bill is a compromise. Some of the folks don't like some of the lessening of environmental reviews. But, you know, we voted for it. We pushed it forward, even though it was a compromise. And sometimes in this business, you have to give a little to get a little. And, you know, it's like I talk about at home. When you go buy that new pickup truck, the dealer wants one price and you want to pay another price. You got to meet somewhere in the middle to get there.
Well, compromise is not a dirty word in my lexicon. Compromise is absolutely necessary. There are things in the bill that I would have written differently. In the conference committee, there are going to be differences between the House and the Senate and how we do some of this. You've mentioned some of the issues, the environmental issues, or some of them are controversial. But there's a major part of this bill to speed these projects forward and to hold the Corps of Engineers responsible for getting things done. Part of it is they got 3 years to do the initial study, and they've got $3 million to get that study done. And their feet are going to be held to that commitment to get these projects moving forward. So there's a lot of reform in here in the bureaucracy of the way this system has worked. There's also a lot of reform in this on allowing the local partnerships. All of these programs are partnerships. They are partners with the local governments, ports, as you described earlier, local levee districts and the like. Those partnerships, under present law, have a very difficult time to start a program early to get it going without the Corps' permission. And so what we have, we call it crediting, and that allows these local governments, local ports, to begin a project. Eventually, there's a whole new process in here for selecting which projects will be done. Oh, by the way, We're not going to do earmarks. There are no earmarks in this legislation. No earmarks are allowed in the future. But there's a process to prioritize projects across the nation, and ultimately Congress is taking back some of its power to set the priorities for the nation. But that crediting that allows the local governments to get started, we're going to want to move that a little bit forward. Because in my district, because of the austerity budgets and the sequestration, many necessary projects are not allowed to move forward. But a little tweaking of this language, which I'll be working to get done, will allow some of these projects to go forward, and the local share would then be counted if and when the federal government, the Corps of Engineers, actually decides to make that a national project. So this is going to be very important, probably important in your area, some of the levees in your area that are maintained now by the local levee districts and flood protection districts. So we spent a lot of time in our House, and the Senate has also. We're going to have to work out some of the differences, some of the compromises, not so much Democratic and Republican, but some regional differences and some differences about how the system should work. So we'll work on that. We've got about another 7 minutes, so if you'd like to wrap, and then I'll wrap, and then I'm going to do something that's not too common here. I'm going to take this ball of some of this international trade, and I'm going to toss it to my Republican colleague, and we'll let him bat it around for a while.
Wonderful. Well, you know, Mr. Garamendi, while you were working in that conference committee, I'd really appreciate it if you could see fit to, and this goes back to the environmental piece a little bit. The Senate bill includes the Middle Mississippi Environmental Pilot Program, which gives the Army Corps of Engineers authority to restore and protect fish and wildlife habitat along the Middle Mississippi River while they're undertaking navigation projects. Now, right now, they're just constrained to working on navigation. Well, doesn't it make a lot of sense, by the way, while you're working on navigation, to also, when you can, improve the fish and the wildlife habitat? You know, in southern Illinois, fishing is a big sport. We have a lot of tourists come in. Hunting, goose hunting is a big sport, and deer hunting. And if you can improve that wildlife habitat, it's going to help the environment as well as help our tourist economy in southern Illinois. Now, that was part of the bill that I introduced, but it got stripped out before it passed the House. But it did pass the Senate. So as part of your conference, if you could help me out with that, I'd certainly appreciate it.
This is part of what we ought to be doing, and that is looking at these issues and maximizing the potential and the benefit that comes from a project. Let me give you another example of the same thing, and it's along the environmental line. Right now, the Corps of Engineers in dredging in the San Francisco Bay Area, let's just say the Port of Oakland over here, when they dredge there, they have to use the cheapest way of disposing of the dredging materials called spoils. They have to, basically, they take it, those mostly sand and clay, they take it out here to Alcatraz, and they dump it in Alcatraz, and the tide takes it out past the San Francisco Golden Gate. Well, we're saying, wait a minute, that's extremely valuable material to build habitat in areas that have been despoiled over the years. For example, down here in the southern part of the bay, these were great salt flats where the salt industry used the bay to evaporate the bay water and get salt. Well, those need to be restored, and it's quite possible that the material from the dredging could be used in that way or in other habitat programs, even up here into the Delta. But it's not the cheapest. So we're looking at a little tweak here that would allow the Port of Oakland or the other ports in the San Francisco Bay Area and really around the nation to do an environmental project along with the dredging project, very similar to what you're talking about on the Mississippi River. So I see common cause here. I see common cause where we can maximize the total benefit for the nation. It could be an additional cost that the port will have to pick up. Okay, but we get a twofer. We get environmental benefits as well as the economic benefits of the port. You got any other things on your list?
I'll just close out with saying, Mr. Garamendi, I thank you for the time this evening, but I think this has been a true team effort from manufacturers and business groups, labor unions, port authorities, and the Agriculture Committee. You know, I sit on the Agriculture Committee, and the ag community knows how critical this legislation is for Illinois. And Congress needs to get things done for the American people. And no job is more important than keeping our economy strong right here at home. Thank you, Mr. Garamendi.
General Earnhardt, or Congressman Earnhardt, or Bill, thank you so very, very much. I really appreciate working with you tonight on this critical issue of the fundamental investment. Let's just remember, this is not new. The Army Corps of Engineers has been around since the very earliest days of our democracy. The Army Corps has been responsible for the waterways of America, and the Water Resources Reform and Development Act is going to be an opportunity for America to really move its infrastructure, particularly the trade. Remember, just review, we're talking 13 million jobs immediately depend upon the Water Resource Reform Act. We're talking about 99% of our trade travels through our ports and waterways, whether it's on the Mississippi, the Sacramento, the San Joaquin rivers, or the great ports and the coastal part of America. It's critically important. And as we do these things, we have the opportunity to reach back into the history of America and remember what the Founding Fathers talked about way back in George Washington's very early days, that these fundamental investments in what they called canals and ports and roads were critical to the growth of the United States at the very, very outset. And George Washington and Alexander Hamilton also recognized the importance of international trade and that we get those trade policies correct. And so as we get ready to do the Water Resources Reform and Development Act, which is critical, and the conference committee starts tomorrow, and I have the honor of being on that conference committee. We also think about the way in which the trade of America is dependent upon our work in getting sound policies in place, and it's also critically important in dealing with the issue of international trade agreements, whether it's the Trans-Pacific Trade Program or the new one that's being worked on with Europe. We have to protect our own jobs. We have to protect the American economy. And in doing so, we must carry out our constitutional responsibility given to us by the United States, us, the representatives and the senators. The Constitution says that it is the legislature, Congress and the Senate, that shall set trade policy, and that requires that we have the opportunity to look at the details of every trade policy and not fast-track trash through the House. Joining me and taking up, as I wrap up my hour, is my colleague on the Republican side. Why don't you take my last couple of minutes, and then you can have your half hour or hour.
Well, first of all, let me thank the gentleman for yielding to me. I know it's a bit unusual when Democrats and Republicans come down and share portions of their time. I think it's actually what the American people want a little more. I wish you do this more often. I'm giving a talk in a few moments on health care. You and I will probably disagree on some fundamental philosophical approaches to that. And that's fine. You're in one party, I'm in another. You have your own inclinations, I have my own inclinations and approaches. But to try to work constructively toward problem solving, I think it would behoove us all if we can figure out a better pathway to do that. And that's why I'm grateful to you for just lending me a few moments, because as I was listening to your speech, you talked about something that I did not know, that George Washington refused to wear a suit made in England and went back and said, give me a manufacturing policy for this country. And it was a very curious but good story to demonstrate a particular dynamic that, as you rightly pointed out, is part of our modern day debate about how we do trade agreements in this fast-track authority. I think we have to be very, very cautious about this. Trade can have the potential benefit to raise all boats. It has to be fair. It has to be has an element of free, but it has to also be enforceable. And there are other dynamics to trade other than just the economic benefit that should be measured, such as the human cost of production in various societies, and we've glossed over those things in the past. So I just wanted to commend you and thank you for raising this issue of giving basically over our authority by saying we'll vote to deny our authority to review the fullness of a trade agreement should one come through to us. I think that's a serious concern, so I want to commend the gentleman for raising the issue.
Well, thank you so very much, and I look forward to working with you on that issue. I know it's going to be coming, well, we don't know exactly when, but they're trying to wrap up, our trade rep, our ambassador is trying to wrap this up and present it to us, and they're talking fast track, and I'm going, time out, guys. Time out. We need to review. We need to make sure that it's fair trade, not just free trade, but fair trade, fair to the American worker, fair to the American manufacturer, farmer, and the like.
If I could add something, I think we ought to call it smart trade.
I like that word, too.
Yeah, throw that
Can we
one in there,
compromise on that?
Yeah, sounds good.
Let it be. I yield back my time. Thank you very much.
Gentleman yields back. Under the Speaker's announced policy of January 3rd, 2013, the Chair recognizes the gentleman from Nebraska, Mr. Fortenberry, for 30 minutes.
The Speaker has unanimous consent to revise.
No objection.
Thank you. Mr. Speaker, thank you for the time. I don't have to tell you all that there is a debate raging in our country about the future of health care. I want to share, first of all, a story that I received by email from Yvonne, who lives in the town of Firth, Nebraska, right near me. She says this: we're a farming family of 5 in southeast Nebraska and recently received notification from Blue Cross Blue Shield of Nebraska, an insurance company, that our insurance premiums are increasing from $578 per month to $1,092 per month. That's $514 more, resulting from the misnamed Affordable Care Act. Yvonne goes on and says, even if I play with the numbers and drop our family income to be eligible for subsidies, my family has never needed government assistance in the past to pay for health insurance. Why should we need it now, other than Washington's interference? Would you please tell me how I am supposed to find an extra $500 in my monthly budget to afford this new, improved policy? Mark, who lives in Lincoln, he says he's 49. He said he had his insurance canceled, and he had a very good policy. And this is what he had to say, quote, I had a $5,000 deductible policy, and after that, everything was covered. My policy was not a junk insurance policy, and it was canceled. Now, Mr. Speaker, many Americans are awakening to sticker shock and are feeling, frankly, very betrayed by the earlier comments that if you like your health care plan, you can keep it. Now, clearly, there is a significant problem here. And what has happened? Well, Mr. Speaker, we need the right type of health care reform. Health care that is actually going to reduce cost and improve outcomes while also protecting vulnerable persons. But what we've gotten instead through the new law is a shift of cost to more unsustainable spending by government, a shift of cost from one American to another, and we also have a serious erosion of health care liberties. There's another email that I received from Joan, and she talked about her son. She's maintained her son's policy, a young man, in case of a catastrophic event, so it would not be a burden to the hospital. She said he does not make enough money to file taxes, but his premium now goes from $85 to $220. And as she says, so my son will no longer have insurance of any kind. My son's new policy is required by law to include things he can never, ever use: maternity for a male and pediatric services for an adult. Please at least allow the insurance carriers to call this what it is, an insurance subsidy from my son to others. Now, this young man is 30 years old. I don't know the circumstances of the family as to why they are providing the policy for their 30-year-old son, but clearly the family is trying to do the right thing and help one another. But they are being forced by escalating cost to reconsider the very idea of carrying health insurance themselves, doing the right thing. Now, Mr. Speaker, when I was a much younger man in my 20s, I had an individual insurance policy that I bought. I thought it was the right thing to do. I didn't want to impose the imputed risk of my own health care needs in case something went wrong in the rest of society, and I bought this policy. It's a pretty big burden to carry for someone in their 20s. It was fairly expensive. So I decided to raise the deductible to $1,000 to basically help better manage the cost. Well, one day I had a very severe headache, and it just didn't seem to go away. And as this went on, I decided it was necessary for me to seek medical attention. So thinking about it, I decided to simply bypass the family doctor, assuming that they would probably refer me on to the ear, nose, and throat specialist. And so I made an appointment with the ENT doctor, probably saving myself about $50 by simply going to the specialist. When I got there, she examined me, and they took an X-ray. And then afterward, the doctor said, well, I really can't tell from the X-ray what the problem is. I'm going to need to do a CAT scan. Now, I interrupted her at that moment, and I injected in the conversation. I said, well, doctor, I understand if you might be worried about liability and there might be this test that is normal protocol for you to run. And she interrupted me. She said, why are you saying this to me? I said, because I need to know if you really need this test. I'm actually paying for it. Again, I had the $1,000 deductible. And she said, oh, well, let's think about this. You know, I'm only looking at your sinuses, so that means that we could probably ask one of the two entities in town with the CAT scan machine if they'll widen the cross-section, and let's see if they'll give you a discount for doing that. So she asked her assistant to help. They called both places in town, found out the price, found out if they'd lower the price based upon a wider cross-section for this test, and one of them did. And I don't remember the exact amount, but I think it was $75. Mr. Speaker, I saved $75 by simply asking a simple question. The doctor got the test that she needed, and the community resource was more properly allocated, all because I had the incentive to watch the cost. Now, this is one of the problems here that we have in the whole health care debate, because, again, in the Affordable Care Act, sometimes called Obamacare, and there's a lot of people who want to move away from that expression, Obamacare, and I respect that. It has always seemed to me to be a bit disrespectful toward the President. So let's call it the Affordable Care Act. The Affordable Care Act shifts cost to more government spending and actually is moving costs from one individual to another. Now, how did we get here? Well, you remember in the Bush administration, the number was being talked about that there were about 50 million Americans who were uninsured. And it's been a while now since I've looked at that statistic, but from memory, as I recall, that was actually an aggregate statistic that reflected the number of people within a year who had some trouble accessing affordable quality health insurance. It was not necessarily a snapshot in time, so the number might have been bigger than what was suggested. But it laid the groundwork for where we are now. Of course, President Obama and the administration used that number as well. But when you parse the numbers down more carefully and you look at Americans who were having problems accessing affordable quality health insurance, whether because of pre-existing condition or some other issue, that number may have come down to perhaps 10 to 15 million persons. Now, that's a real problem. That's a lot of people who need help. And the right response is to engage in policy debate that will actually help them access affordable quality health insurance. But we've done so by turning the entire health care system inside out, and it's creating havoc, sticker shock, and many Americans are feeling betrayed, particularly those who are buying their insurance in the open market and the individual market. And soon many more will be receiving the price shock who have employer-based insurance because of a couple of factors. And what are those factors? Well, first of all, in the new law, what has happened is there is a shrinkage of the age ratio. It used to be 6 categories, as I recall. Now it's 3, by which you can price the product. That means younger people are actually subsidizing older people. Now, you can have a debate about the merits of that, but that is one of the cost drivers. Secondly, there's all types of new mandated benefits. You heard it in the emails that I received. First of all, a very young man is having his insurance rates skyrocket simply because he's a young male. In Nebraska, we have one of the highest rate increases for single males. It's second only to Arkansas. It's 220+%, as I recall. Now, why is that? We were somewhat lower mandated state, a less regulated state, if you will. But what that created were market conditions whereby a young person who was relatively healthy could get an affordable quality health insurance policy that protected them from catastrophic incidents if they were in an accident or if an unfortunate disease happened to strike them. They were covered. But now it's pushing those policies to a level where people are questioning as to whether or not they can afford it. A policy designed to actually help people is hindering those who've been doing the right thing from purchasing insurance. The mandated benefits issue, as he pointed out, older gentlemen are writing me, I don't need maternity services. Again, those incorporated into the law, an inability to customize an insurance policy based upon one's particular needs after us deciding what is a reasonable set of basic coverages that are necessary, which used to occur state by state. The third is no denials. Now, this one is a little bit more sensitive because, again, we do have Americans who are being helped by this law and who had previously been either denied because of pre-existing conditions or, for one reason or another, were having problems accessing affordable quality health insurance. So as we move forward into a debate as to how we are going to reform the system and perhaps get this right, it is necessary that we carry forward either this way or another way. It used to be the government subsidy of high-risk pools in which we allowed people to have access to more affordable insurance. Either that way or this way, whereby we all absorb the cost across insurance policies, that we take care of people who rightfully need access. And so there are a few embedded pieces of embedded policies in this Affordable Care Act that do make some sense. The first one was allowing young people to stay on their parents' policies a little bit longer until the age 26. I supported that before the Affordable Health Care Act. Makes sense, replenishes your insurance pool, helps enculturate the concept of buying insurance at a young age, and hopefully that carries forward into creating a more robust, dynamic marketplace. Second, again, dealing appropriately with people who have pre-existing conditions, and there are a lot of ways to do that, either, again, by subsidizing the market directly since it was somewhat broken, or absorbing the cost across all insurance products. The third issue was removing insurance caps for those who actually bumped up to their total maximum benefit. Now, I knew of cases where families who were struggling with a severe disease condition who would meet their insurance cap, and the response was they simply had to leave their job and go find another job in order to get employer-based insurance to basically start the clock over. That doesn't save the system any money. It just burdens the family. So those are three aspects of the current health care bill that make some sense. But we did not have to do so by turning the entire system inside out and harming disproportionately large numbers of Americans who've been doing the right thing, protecting themselves and not relying on society for the imputed cost of their own health care risk, who were trying in a marketplace to find the right product for themselves, but now who have lost access to basic products like good catastrophic coverage, which were lower cost for younger people. That is a very strong disincentive for young people to actually enter into the insurance market, and that needs to be corrected. I think it's also part of our responsibility for those of us who have said no to the Affordable Care Act, who have said there are better ways to reform the health care system, to start laying out some specifics. Well, one of the specifics should be that we all ought to try to agree that the health savings account idea is a way in which we form a hybrid model that actually benefits the marketplace, benefits individuals, and retains the robustness of what private market competition can give you. Now, let's take, for instance, the case of the surgical procedure called LASIK. Now, I'm not aware of insurance policies that regularly carry that procedure whereby the eye is operated on to correct vision. Large numbers of Americans have been helped by this extraordinary technological invention. And it appears to me, from a cursory look at that market, that prices have fallen, outcomes have improved, and the doctors who do this surgery seem to do pretty well, with basically no insurance involved. So let's look at the health savings account model as a hybrid model whereby we retain the government subsidy in a certain sense by allowing people to set aside an account on a tax-free basis, and they accumulate monies that go toward their first dollar health care cost, taking better control over those first dollars that are expended. Now, Mr. Speaker, I recently had a medical issue. I had a sore spot on my ear. I didn't think much about it, but after about 3 weeks of it having been there, I thought, you know, at my age, maybe it's good to get that checked. So I went to the dermatologist, and he looked at it, and he said, Jeff, I think this is 50-50. It may be a cancerous type condition. I said, all right. And he said, I'm going to put you on a medicine, and we can go ahead and get started now while we wait for the biopsy to come back. So I went to the pharmacist to get the medicine, and my copay was $5. I'm very grateful for that. It was very easy for me to, and I'm thankful that I had the insurance to be able to do this. It's $5. And I asked the pharmacist, though, I said, how much does this medicine cost? He said, well, I don't know. Let me check. He came back, he said, it's $500. And I said, well, this is Friday. I'm not sure on Monday if I'm going to need this medicine or not. It's 50-50. Maybe we just ought to wait. And I chose to wait. So on Monday, the doctor called back and said, we found out it's benign, not cancerous, nothing to worry about. You don't have to take that medicine. Well, you see, I had no incentive not to take the medicine. The doctor didn't necessarily think through that question with me. He didn't have to, because my copay was simply $5. Again, I'm grateful for that. But the point being that $495 of waste would have occurred in the system had I not simply asked a question. Had I not, and I didn't have any incentive to ask a question, I was simply trying to make sure that we weren't imprudently using that much medicine when it may go to waste. And I'm glad I turned it down. So again, that's the point. And if you have your own health savings account, which is coupled with a catastrophic policy, two things are occurring at once. First of all, you're controlling your first dollar cost. You have a normal conversation with your doctor about ordinary health care. Is this a test? Is this the pathway we need to go? What are our alternatives? Who can provide those in town? Maybe at a cheaper rate with the same quality. Now, for that, we need price transparency, though, in medicine. It's an important part of market reform that needs to occur. But if something really goes wrong and you're on a hospital gurney getting rolled into an operating room, you shouldn't have to pull off your mask and say, can somebody give me the price of the anesthesia around here? That's not the point. That's different. That's a catastrophic condition. With catastrophic insurance, you should be protected from having to worry about those market dynamics. So I think this is a good hybrid model whereby, again, the government incents you to put money, a little bit of money aside in a tax-free account, which, by the way, that could accumulate over time. Now, most people don't get sick in their life, and a lot of this money could grow to a substantial amount over time and actually be a supplement in retirement or supplement to Medicare. We've got long-term cost problems in the Medicare program. So again, thinking dynamically, creatively as to how we restructure health care and give improved opportunities for a robust marketplace for health insurance that doesn't just consolidate the marketplace into fewer and fewer companies. It has been suggested that what is happening now is this is becoming like a utility system. There's just going to be a few insurance carriers who work with hospitals, and that's it. And the government will have a role in setting certain rates, and that's it. So you lose the dynamic of the competitive model for the insurance market while, again, protecting people's access. We should allow people to have access to affordable quality insurance and not simply be denied for pre-existing conditions. There's a lot of ways to do that. But if we do that, we can keep the market dynamic basis for controlling health care costs. We do this in all other areas of our life, and it's normal to us. There's no reason that we have to put on blinders when we're dealing with ordinary health care costs and simply submit to the system, whatever they tell us to do. There's no reason for that. And what we could see, again, if we inject this sort of competitive marketplace for ordinary cost, competitive competition in the marketplace for ordinary processes and procedures in medicine, for drugs, then you could see, like the LASIK surgery example, prices falling, innovation occur, and the healthcare system making reasonable returns for their efforts. Right now we have a healthcare system that is very, very frightened. Many doctors are very frightened of the next steps in terms of the evolving dynamic of the Affordable Care Act. You have many doctors who are saying they're not going to be able to afford to take in any more Medicare patients. You already have this problem in Medicaid. And so you want a robust, dynamic market where people are innovating, where costs are falling, and healthcare outcomes are improving. The health savings accounts gives people the opportunity to control that first dollar cost, but if they're really sick or have an accident, they're protected and don't have to worry about those costs. That makes a lot of sense to me, Mr. Speaker. In the Affordable Care Act, unfortunately, though, what we have is a dampening of the marketplace for the health savings account idea. It ought to be exactly the opposite. Now, there's a reasonable argument that some have made that this is not appropriate for people who are older, who have increasing health care costs and don't have the time to set enough money aside to meet their normal, ordinary expenses. Fair enough. But it is an important model that we should be eagerly embracing for the young generation so that they can have affordable, quality, catastrophic insurance, that they have incentives to move into the market, that the market responds to their questions as to why does this cost this much, who is providing the best service, does this really make sense? With us simply trying, with a diminished marketplace, with a lack of incentive to actually watch those first dollar costs, as the health savings account gives us, then there isn't really those incentives to, again, force transparency and ask simple questions as to how you best manage the resources that you have in partnership with the medical community, like I did when I was trying to reduce my own costs for that CAT scan, and the doctor very willingly accommodated my request, and that community resource was better allocated. Now, to me, that is a common sense solution that we all ought to be embracing. But instead, what we have now is, again, a huge shift of cost to more unsustainable government spending, and many Americans being disproportionately hurt because of skyrocketing premiums, or they're losing the health care that they were promised they could keep. Now, that's simply not fair. There is a better way to fix this system. In the last few weeks, because of the problematic rollout of the Marketplace website, the exchange as it's called, it has brought more and more attention to this issue. Now, it's my hope, Mr. Speaker, that we just don't get into finger-pointing and we told you so, or for those of us who are against this, but that we actually sit down and try to construct something that is much more reasonable and fruitful for the entire system. Mr. Speaker, the formal definition of a law is an ordinance of reason given by those in authority for the common good. You have a real question here as to the reasonableness of this law, because it is so unfairly and disproportionately hurting a lot of people, and whether that meets the definition of it being for the common good. There are aspects of the current law that we can retain, as I suggested, keeping young people on insurance longer, removing the caps on insurance, and protecting people who have pre-existing conditions. Those should be retained, I feel. But as we move forward with a robust debate, we ought to keep in mind, let's do everything, let's do all we can, give America a better path forward, the path that they deserve, so that health care meets the true definition of a truly just law. Any health care reform meets the definition of a truly just law, and that it promotes the common good, which means society's well-being. And what does that common good look like? It's a vibrant marketplace for affordable quality insurance. Persons who have had a condition shouldn't be denied. There should be a dynamic where the person who controls their first dollar costs, because they own those dollars, and they are protected if something really goes wrong through catastrophic policies. That shift of the health care paradigm could lend itself to the right type of reform for the next generation, for Medicare, for instance. If you've had a huge savings account accumulate over time because you're not one of the unfortunate, one of the majority of people who fortunately does not get stricken by something serious over your lifetime, then you'll be able to potentially use that money for your own well-being in retirement or as a further supplement to the Medicare program. This is what's called thinking outside the box. Instead of, let's think dynamically as to how these programs can mutually reinforce one another, current health care reform and our important health safety nets in retirement. That's what we ought to be thinking about. And so, Mr. Speaker, I just submit these comments this evening because I think it's important to try to unpack what has gone wrong and why, to frame the debate in a manner that's actually constructive so that America gets the type of health care reform that we deserve, a robust health care system that leads the world, that improves health care outcomes while reducing cost, but also protects vulnerable persons. I yield back.
Gentleman yields back. For what purpose? Does the gentleman from Nebraska seek recognition?
Mr. Speaker, I move to adjourn.
The question is on the motion to adjourn. Those in favor say aye. Those opposed, no. The ayes have it. The motion is adopted. Accordingly, the House stands adjourned until 10 a.m. tomorrow for morning hour debate.
The House today debated a bill to expand oil and gas drilling on federal land. That measure is not expected to be taken up by the Senate. They also worked on legislation to continue a Bush